Okay, so the next complication we're going to talk about today is called axillary web syndrome. We commonly refer to it as cording. This side effect is very common, and actually, we find that it happens in about 90% of post surgery patients.
So, what exactly is it?
Unfortunately, we don't know exactly what causes it. Our best understanding of it is that it's like a tightening of the connective tissue that surrounds those lymphatic vessels. And so they almost scar down like and form like a cord or a rope like structure. Most often in the armpit, but it can occur along your rib cage and even into the breast tissue. Some of them can be larger in size, more rope like as you see in that picture near the armpit. Some of them can be really small and thin, almost like a guitar string, which you can see in that picture near the elbow. They are sometimes visible when you look, like in that picture. Sometimes they're a little more hidden, and we have to actually move the tissue around in order to feel them or see them. After surgery, as you start moving around the house and getting back to normal, you might feel a tightness or a pull in your armpit, and often that's cording starting.
Are they painful?
Some people don't have any pain with them, but some people do have some discomfort. Typically, it would be with stretching, like reaching overhead or something like that. And it's often described as like a burning or stinging or kind of a chafing type sensation. Sometimes you can have a little bit of discomfort when we're working on the cords and we're, touching in your arm to stretch it out. So there is sometimes some discomfort with it.
Do they ever go away?
Unlike a muscle tendon that gets tight and you stretch it and then it gets tight again and you stretch it on and on. All the progress you make when you stretch your cords, you get to keep. It doesn't typically re-tighten. So that's a nice thing about cords. Sometimes those very thin guitar string cords will actually snap or release. That can happen without you even knowing it. It can happen with your movement. It can happen when we're treating those cords. Sometimes there's a little bit of temporary discomfort with that release, but generally it brings lasting relief and improvement in motion.
Okay, so is there anything I can do to prevent the cords from happening?
It's pretty close to a guarantee because it's about 90% of patients.
Okay.
So there's not really anything. These exercises that I'm giving you aren't going to keep you from getting cords, but they are going to work as your very first treatment. So in those first few days after surgery, it's important to do these exercises to regain your mobility, to help get those cords stretched right away, and to prevent other issues with your shoulder joint happening, like a frozen shoulder or something, if you didn't move it. So, when you come back to physical therapy after your surgery, that's when we would want you to wear like a loose fitting tank top or shirt so that we can take a peek in your armpit, see how many cords there are, if there are any, and get you right going on stretches for home and see if you need to come back for more physical therapy to treat those cords.
Do they come back?
Patients often will feel tighter after radiation, so sometimes we like to wait to discharge you until we know that you've gotten over that hurdle without feeling tightness come back. Otherwise, the cords themselves, it would be very rare for them to retighten. Other than that, do you have any other questions about cording?
No, I don't think so. You
Okay.
explained it well.
Okay.